am Isaiah. I am Isaiah Fudge. I'm the Director of Positive Youth Development here at Advocates for Children of New Jersey. Thank you for joining us. If you're unfamiliar with AC&J, we are a nonprofit, nonpartisan advocacy organization addressing issues that exist statewide, issues related to children. Our mission is to ensure every child has a chance to grow up safe, healthy, and educated. Our newest initiative, which is Positive Youth Development, piggybacks on this mantra, examining how safety, health, and education intersect to impact youth. We hope to elevate the strengths of youth in their communities, building on what makes them thrive and supporting the work that prevents youth justice involvement. We also want to eliminate legislative, procedural, and narrative barriers to youth progression, including those barriers impacting their caregivers. We do this through advocacy, of course, but we also inform and create spaces for learning so that folks can learn about the important work being done to impact youth. And I think Lunch and Learns are a great place for learning. Each month, on a Wednesday during the traditional lunch hour, AC&J hosts a conversation on an important topic related to children, related to youth, and their families. We appreciate you sitting with us during this hour, and we offer our knowledge on the subject. If we don't have knowledge on ourselves, then we invite an expert or experts on the subject to share what they know. So today's topic will be New Jersey Statewide Student Support Services, commonly known as NJ4S. Our experts will dive deeper into it, but NJ4S is a hub and spoke prevention model working with schools and communities to assist youth and families. There are 15 hubs across the state, each led by a director. Today, we have directors from 3 of the hubs to discuss NJ4S, to discuss their work and how they support schools and reimagine mental health models. We have Michael Lavalio, Mercer County Hub Director from Catholic Charities of Trenton. We have Diane Travers, the Essex County Hub Director from Family Connections. And we also have Ruby Seiko, Middlesex County Hub Director from Rutgers University. Welcome, guys. And so we'll start with Michael. Michael, can you give us an overview of NJ4S, and can you tell us how 4S differs from traditional mental health services?
Absolutely, and thank you, Isaiah. Good afternoon, everyone. Thank you as well for spending the noon lunch hour with us. The next 10 minutes will be casual, conversational, with slides for your convenience. So, what is NJ4S? We are New Jersey Statewide Student Support Services, as Isaiah said, providing evidence-based prevention education and brief clinical services. At the height of the pandemic, the Department of Children and Family Services partnered with Rutgers for a statewide survey, which found that 65% of caregivers reported being very or somewhat concerned about children's mental well-being. The solution, NJ4S. We have 15 hubs, and as Isaiah said, with you here today are the directors of the Mercer Hub, the Essex Hub, and the Middlesex Hub. The NJ4S model starts with a 3-tiered approach to mental health. Tier 1 is universal prevention education. Tier 2, targeted evidence-based prevention education. And Tier 3, brief clinical intervention. So for Tier 1, universal prevention education, this is available to the community at large. No referrals are required. It includes activities such as curriculum efforts, workshops, webinars, assemblies, and trainings. Tier 1 services can also include partnerships with existing community resources. And our focus areas in Tier 1 are mental health and well-being, positive peer relationships, job readiness, career exploration, and classroom management. Some examples of Tier 1 services include prevention education workshops, signs and symptoms of mental health conditions, social skills, stress management, and job readiness. Webinars can include suicide prevention and co-parenting. We also can provide academic support via Zoom and or in person, and those can consist of, but are not limited to, books clubs and college prep support. Our Tier 2 services are targeted evidence-based prevention services, and these are available to students, families, and school staff for grades 6 through 12 in eligible public schools. A referral is required through DCF Connects for these services. They are evidence-based, targeted prevention interventions, typically delivered in small groups. These focus areas include substance use prevention, sexual health, pregnancy prevention, suicide prevention, anti-bullying and violence prevention, and other areas of need. Tier 2 service examples can include evidence-based curriculum on bullying prevention, conflict resolution, and drug prevention. This curriculum is available for students, parents, as well as classroom staff as well. Evidence-based lessons are also available in sexual health. Tier 3 services include brief clinical intervention. These are available to students, families, school staff for grades 6 through 12 in eligible schools. A referral is also required through DCF Connects. This service provides an assessment and brief individualized clinical interventions in person, at the school, or via telehealth for students. Clinicians are also available for consultation with school staff or for brief counseling or referral for family members. Some Tier 3 service examples include alcohol screenings, anxiety screenings, the Columbia suicide screening, depression screenings, and drug screenings. Our clinicians also make referrals to students on behalf of students and families for additional services. They can serve as a connector and make sure that families are connected to their next source for services before our job is done. NJ4S is not intended to replace existing programs and services or disrupt established relationships between schools and community services. Hub staff rely on and connect students and their families to existing community resources, and the Hub prioritizes services to school districts based on the School District Needs Index. Our team consists of a large group of prevention education consultants. These are the folks who are out there working with the community at large and schools. They are then supervised by supervising prevention education consultants. And when folks request services, they are greeted by scheduling coordinators. And our licensed clinicians provide those Tier 3 clinical services. Each hub also has an advisory board, 25% of which consists of caregivers and students. The purpose is for us to have community input into service design. And their duties consist of determining our hours of operation, providing information regarding areas of need, assisting in selection of evidence-based models, and providing ongoing input and assessments. So how does all this work? No one will need to travel to a hub to receive services. Services are pushed out to spoke locations in the community. As Isaiah said earlier, NJ4S is a hub and spoke model. And these locations can consist of schools, community centers, and other places identified through the Hub Advisory Board input. DCF has developed a system with Salesforce entitled DCF Connects to be used by schools eligible for Tier 2 and Tier 3 services. A school or organization seeking universal Tier 1 services can simply call or email a scheduling coordinator in their county's hub. Participation in NJ4S is optional. Tier 1 services are available to the community at large. School districts may opt to apply for NJ4S Tier 2 and 3 supports, and existing DCF school-based youth services contracts remain in place. So I had mentioned the needs index earlier in collaboration with Rutgers that was created with DCF, and I will add that into the chat right now. There we go. And thank you all for your time.
Thank you for that, Michael. I just want to, so I know for me, just speaking personally, right, putting on my dad hat, knowing about the services and supports that exist as I have a little girl heading into middle school. Um, Knowing about this type of service, knowing about these supports, it can be it can alleviate some anxiety for me, right? Because I do know that there's a component that I've experienced, but she's never experienced, right? And so I'm worried about it. That's what I'm trying to say. I'm worried about her, and I appreciate all of the support that she can potentially receive. So I'm excited about NJ4S, and I'm excited to bring Diane on to talk a little bit about families and the benefits of NJ4S programming. So, Diane, can you just speak to the benefits of NJ4S for not only families, but also for the students and for the schools that the students are coming from?
Sure. Thank you for that introduction, Isaiah. And Michael, thank you for that wonderful overview. Describing NJ4S services is definitely complicated. So I think Michael really touched on all that we offer. In discussing the benefits of this statewide program, I think without stating the obvious, the number one overall benefit would be that this program significantly expanded support services for students across the state of New Jersey. So we serve public and charter schools. And, previous to this, the state relied on the school-based youth services programs, which are wonderful and comprehensive. Family Connections has 5 of our school-based youth service programs operating here in Essex County. But as we know, they're limited to the schools that they are housed in. So what NJ4S did was really expanded and made accessible a number of supports for students throughout the schools. Another significant benefit, I think, is that there is absolutely no cost whatsoever to a school district, to a family. All of our services are covered by the grant, by the Department of Children and Families. And I think this piece is in looking at the services, it's obvious that the services are concentrated for 6th through 12th grade students, but just to give you a glimpse on how expansive that is, here in Essex County, we have 125 eligible schools. And out of that, 106 of those schools have been rated high needs. So as Michael touched on, there was a school district needs index that was implemented, as well as a community needs index. And that led to the ranking of schools in high, moderate, or low needs. That doesn't mean that a low need school is not eligible for services. It just means that high need schools get priority. So we encourage you to take a look at the needs index as well, to look at the different indicators, which really led to the rankings. So also here in Essex County, as Michael mentioned, tier 2 services covered by prevention consultants. We have 32 prevention consultants who are trained in 20 evidence-based programs. And when we say evidence-based, we just mean that these are scientifically researched and proven to be effective to the communities that we serve. And Michael touched a little bit on how some of those needs have been identified by the Hub Advisory Boards. And so in different counties, different needs may have emerged, but we definitely see very similar trends across the 15 hubs. So one of the other, I think, benefits of our program is that our staff, culturally, they represent the communities that we serve. So our staff have lived experiences. Many grew up and attended the schools that we're providing services in. They speak the languages that our families speak. We have 10 bilingual staff across our clinicians and our prevention consultants. And that's come up as a really significant piece for our schools and obviously for our students to be able to relate to the staff as mentors. As you can see, with 32 prevention consultants, the majority of staff, about 75%, are concentrated in these tier 2 efforts, which is really, as we say, a prevention service, prevention program. And we have 10 clinicians who serve the students in the tier 3, providing the brief mental health counseling. So if you look at the benefits of prevention services, I think the key thing is that overall, prevention services promote mental health and well-being in our students, in our families, in our educators as well. And prevention education can actually ward off future problems if programming is implemented in advance. So an example of that may be Isaiah shared, obvious concerns about having a daughter who's about to enter middle school. We know transitions to middle school and high school can be problematic. We can implement groups for youth. Let's say we're trying to change kind of the culture of the 6th grade schools where typically there may be some, bullying going on, some, impaired peer relationships. We can implement these tier 2 prevention groups at the beginning of a school year to 6th grade students and help teach them conflict resolution skills, help enhance their self-esteem, and try to, again, change the dynamics so we can anticipate, the problems before they actually begin. Additionally, prevention education provides knowledge and skills building to our students. So what we're doing is we're giving them the knowledge and the information to make informed choices that overall impact their well-being. An example of this could be substance use prevention groups, or our Safe Dates curriculum, which looks at intimate partner violence and helps teenagers identify unhealthy romantic relationships to avoid the development of any, domestic violence further on down the road. So by implementing these programs in advance, we can help change that narrative. Last, I think prevention education really promotes a healthy and safer school environment. So we try to foster social awareness among our students, giving them a sense of responsibility in their schools. And through that, hoping to change the culture in the schools to one of respect and empathy. So an example of that could be our aggression replacement training. This program in particular works with 6th to 12th graders and has 3 distinct sections, which are anger management, violence prevention, and moral reasoning. So if we've got students who are externalizing behaviors and acting out, within their schools, and we implement a program such as this, we can obviously help change that culture within the school to promote that respect for, for students among them. I think another additional benefit, as Michael touched on, is that our program isn't just for students. It's also here to support families, and it's here to support educators. So we do many professional development workshops for our educators. We are asked oftentimes specifically to create topics that are relevant to a particular district. One of our large charter districts asked for a workshop on how to create gender affirming schools. They also additionally asked for a very brief webinar to share with all students in advance of standardized testing to help our students manage the anxiety that often comes with taking a standardized test. So a benefit of all of the different hubs is that we can customize our services specifically to the counties. And last, I would say, as Michael said, no one has to travel to a hub. Our Tier 3 clinical services, our staff are going to the schools in the community. They can provide in-home or telehealth services. We can do individual, family, and group therapy. Our clinicians are trained in cognitive behavioral interventions for trauma in schools. We recognize that trauma has a significant impact on our students here in Essex County, and our staff work with the families to make sure that the students are linked to any ongoing services if those are indicated. And last, I just wanted to mention that we've been one of 3 counties to pilot this year a collaboration with the Pediatric Psychiatric Collaborative, which is run by Rutgers UBHC here in Newark. And this allows us to refer our students for very immediate psychiatric evaluations. So we know that there's a shortage in the community, and our students are often on long waiting lists for those psychiatric services. NJ4S Essex can actually refer right to the program. They'll provide a comprehensive psychiatric evaluation and then work with the family to implement whatever recommendations. So you can see that just this array of services really helps provide just kind of a big umbrella of support for our families. Thank you.
Thank you, Diane. We appreciate that robust explanation of your work. So, Ruby, talk to me. Talk to me, Ruby. Let's say I'm a parent who I'm not a helicopter parent, but I like to be hands-on, right? I like to be proactive with my kid. How can parents get their kids involved, their students involved, and how can parents get involved themselves?
Thank you, Isaiah. That's a great question. Following what Diane said and piggybacking off of what Mike sort of said as well in his sort of introduction is, as a parent, there's many ways to get involved, right? So the most obvious way is we encourage, just like Michael did in his presentation, that 25% of our community advisory board member needs to be youth or parents or caregivers of the community. That's like a very quick way that somebody can say, hey, I would like to be a part of your community advisory board. I would like to sort of provide direct input or just, learn sort of what's out there and give my feedback on how I could benefit from the program and how I could sort of share it forward. Each, community advisory board across some of the hubs, we have subcommittees. So for Middlesex County, we have our community advisory board, which is made up of community members, and families are a big part of that. Like you said, you wear the dad hat, but you're also an advocate, right? So we have people that sort of wear those multiple hats. They come in, they're like, I'm not doing this. I'm only showing up to your community advisory board as, a mom dealing with similar things, a student transitioning from middle to high school, right? So we encourage that being the most sort of direct way that somebody can be a part of the hub. They can join a subcommittee meeting. As a result of Middlesex having a lot of students, we had to sort of have a subcommittee for youth, and they meet more often than the community advisory board meetings. And what they do is very, very instrumental in terms of helping us really understand the needs of the community, right? So from a youth perspective and a caregiver perspective, your voice is really important to be there. If, you wanted to just learn about more resources for your toolbox as a parent, or even for your toolbox, as a student, it is, those tier 1 services. They're all free, right? They're all available. If there's something virtual in one county or something in another county going on, nothing's stopping you from sort of attending those. You can sort of reap the benefits of all of the tier 1 offerings that are available. So you can, say, okay, what are they offering that's related to anxiety or transitioning from middle to high school? You can sort of go on and see all the happenings and all the events and all the workshops and say, oh, okay, this is something that totally applies to me, what I'm feeling as a parent. Or, if there's a young adult or a youth or a student that also sees, okay, this looks really interesting, right? There's a presentation on coping skills, but it's at a comic store. So they're going to also talk about healthy coping skills related to like using, the comics, right? So there could be something that aligns with what you want. So that's one way, looking at the tier one. The other way is looking at getting involved in a community advisory board, a youth advisory board. Maybe you can attend all the meetings. Maybe you want to be a part of a subcommittee. There's that way. We also get, just like many hubs, direct emails, right? Like, hey, do you guys offer this? And maybe it's something we weren't offering at that time. We had a request just a couple of weeks ago. How do I talk to my youth about like civil unrest and, the upcoming political stuff, wherever you fall along that. So we said, okay, we don't have anything yet, but it made us think why there's a need. A parent and actually a student asked for something like this. So now we have two people asking for it. So we're going to work on what that looks like and then turnkey that into a free presentation in the community, whether it's in person at any of the spokes or it's virtually, right? We want to be able to offer it in multiple ways that meet the needs of the community. Another way is parents and even students can go to their schools and say, hey, I heard about this NJ4S program, this robust program that Diane and Michael just talked about. And I really want to look at, how can I benefit from it? Who do I contact? Who's my school rep, right? There's a couple of girls that I think could benefit from one of these sort of tier two groups. Can I talk to the school? Who's my identified school rep? And they can then find out who that person is and, sort of look at advocating for themselves and getting services. Again, those sort of tier two and tier three requires a referral, but there's nothing that says you can't contact and say, I heard about this NJ4S program and I want to know who my school rep is, right? We will know that at the hubs ourselves, so you can also directly contact us. But people that have longstanding relationships with schools and there's a new program around might be a little bit, cautiously optimistic about it. So sometimes they go to the schools and say, what is this? And the schools will say, okay, this is your rep. Or if there is no identified rep, then they work on making sure, well, who can they identify in the school? It's interesting. We've had some youth and caregivers just want to help volunteer and table an event with us. Because it's something, there's a walk we were sharing and how can we help? Could we be there and share brochures and talk about, how we attended a workshop or a webinar and it was beneficial. And we say, sure, that would be nice, that you're spreading the word and you're talking about how helpful you found a topic or a presentation or our services. So just even asking to sort of be a part of some of the hub activities and events can be very beneficial. Our youth are really, our youth advisory board members that volunteer, very active, right? So they're reviewing all of our marketing. That's not cool. This isn't good. This needs to be presented. And they're also attending our tier one events and, sharing feedback on what they're seeing. And then they're helping us sort of set up. So it's really important to make sure that, there's not just one way you can sort of join and get services, right? You can also just sharing what you don't see available, right? That in turn can help us say, okay, there's a lot of resources in many counties that people are not familiar with. So even getting in contact with us and saying, okay, if we don't have to do it at the hub, but we might know another community partner that's doing it well. So we're able to sort of turnkey and share that information. Families can follow all of us on social media. All the hubs have an Instagram, they have they're on LinkedIn, all these sort of platforms, but that's another way to see what's happening, right? You can also go to the NJ4S website, which shows all the happenings, but you can also see, and we even ask, in our platform, social media sort of campaigns, what else do you want to see? What else are you looking for, right? So it's also another direct way to get feedback. It's really important that parents and youth who've attended one webinar session at any moment, found any part of the program helpful, to sort of share with other people. Yeah, maybe that wasn't the exact topic I was looking for, but wow, I found or stumbled upon a whole bunch other. So even sharing that word amongst themselves and the communities is important, right? It lets us know that you want to learn more, or you're interested in sharing more, or even if you don't have ideas, you're still there to listen, because maybe that in turn will help you come up with another way to either advocate for what you need for yourself as a family or for your child, or just in general for the community. So, you can visit any of the NJ4S websites, and it has all the happenings of the events and programs and the direct link to also the tier 1 offerings across the state, right? You can reach out directly. I'm speaking for Middlesex, but I'm pretty sure all the hubs will say emailing, their hub emails directly, going to the website is another way that you can sort of gain specific information. Like, I'm looking to, go and learn about this topic and share that idea, right? Attending a workshop, an informational session, right? We all offer those. Somebody could attend this, even though this is recorded, and be like, oh my God, I forgot what that NJ4S was about. And then there's another informational session, and maybe they recruited somebody else, right? So there's another opportunity for you to learn about that way. And then, like I said, joining the Community Advisory Board has been extremely beneficial to us, right? I'm from Middlesex County. I'm a proud public school graduate of Middlesex County, right? So my lens is going to be different for Middlesex County than who somebody, that's going to school now. Some 15-year-old person that's going to a middle school is going to share a different experience than one I had when we didn't have a middle school in my town, right? So it's really important for us to have an opportunity to listen. And the community by far knows more of the needs than we will. So we need to, we're experts, but you're really the experts in terms of the needs. So helping us adjust and tweak, right? That's a really, really, really powerful tool that we're lucky to have in our county, that we have, people that are wearing multiple hats, dads and moms and caregivers, right? But also students and youth that want to be a part of learning about the program, sharing their ideas, giving us feedback, allowing us opportunities to pivot and do things in a different way. So following us, emailing directly, joining a community advisory board, and if you're a local hub, right? Those are all impactful things. And some people work in one county and live in another, and that's okay. It's where we feel like your voice is going to matter the most. Is important for us to make sure we hear from you. Yeah, those are multiple ways, right? And if I didn't mention any, and you're like, she didn't mention this one way, email us and we'll make sure that we address that in some way as well.
Thank you, Ruby. I appreciate that. So now we'll open the floor up. I see a question that hasn't been answered, and I think it's a pretty good question. We'll open the floor up to our audience. So, and feel free to just come off mute and chime in, Ruby, Diane, Michael. So the question is, how do 32 prevention consultants serve 100+ high-need schools? How does 25% of staff handle tier 3? And how do community providers already offering prevention education work together with NJ4S?
Yeah, so I think, as Michael mentioned, none of the NJ4S services are meant to replace any existing services. So what we do is when our scheduling coordinators take an application from a particular school, we actually ask in that initial conversation, what other services do you have access to? So for example, we implemented the teen outreach program in a particular school to a group of 6th graders, but we were informed by the school that they already had an affiliation with an organization that was providing the teen outreach program to up to fifth graders. So it worked out perfectly because we can't provide tier 2 services to fifth graders. But if we had been told that this community organization was already serving the sixth graders, we would have encouraged them to go through their existing community resource, and then we would suggest other evidence-based practices that we could implement. And I mean, it's a great question in terms of the numbers. Obviously, when you share there are 100,000 students in need, but 42 staff to serve them, it feels kind of daunting. I think the most important way to look at this is that a lot of our groups are up to 10 weeks in length. Our clinical services are up to 12 weeks. So while our clinicians may have 15 to 17 students on their caseload, they are able to serve that many more throughout the course of the year. So while it certainly doesn't cover every single student in need, we do know that we've significantly closed the gap of, what's been a tremendous mental health crisis in our youth. And we've been able to provide, kind of, while it might feel like it's the tip of the iceberg, a lot of what we do as well is link our families to those existing community resources so that they can have those ongoing supports.
If I could just add to what Diane just said, a good example is sometimes Diane said it earlier, there's wait lists in the community, right? So if somebody makes a referral for us early on, we're early intervention prevention. So the idea is that if you need CMO services, which is care management organization or perform care services, right? Those sort of more higher intense level, we wouldn't be servicing those. I say that sort of in a caveat that, is there a place where during our work with somebody, we feel like that linkage needs to be made? We stay there till they're connected. So there's has to be this warm handoff that happens. Our services are short, brief clinical interventions, right? So we're not thinking traditional outpatient, right? So the idea is that we could do, like Diane said, 12, 14 weeks, 10, 12 weeks of something, and then move on and sort of stagger cases. And we have access to resources like Diane talked about, the pediatric collaborative, that in between, while they're waiting for an outpatient or something, we can link them with a psychiatrist and still monitor to make sure that they're connected so we don't sort of just drop off. We're not going to say 10 weeks we're done and that's it. No, we're going to make sure that, that sort of continuity of care is maintained. Yeah, it's a lot. Diane has 32. I mean, Middlesex has a little bit less. We have 3 clinicians. Well, we just expanded to 5. But, it's working. We would like to see more of the groups, but we're glad to be able to take some of those tier 3 individual services. And for now, it's going.
Ruby, thanks, Diane. I did just want to comment too. I think so often in some of these high needs communities in general, but especially in high needs communities, we kind of get wrapped up in the idea of the need or the association of mental health services with clinical experiences. I think part of that association creates a stigma. And what I like about 4S is that the programming that you guys offer, especially in that tier 1 realm, it kind of is the stigma or relinquishes the stigma a little bit, right? Because the programs that are offered, the supports that are offered are not necessarily that sofa and tell me what your experiences are, and I provide therapy. Rather, it's more, let's go to a movie, let's, those types of things, which all have an impact on mental wellness. So I definitely appreciate how, especially in that tier, it does a lot to mitigate stigma that are associated in, especially in like Black and brown communities, right? But we did have a couple of other questions in the chat. Let's get to those. So I work for NJSACC, and we are contracted by NJDOE and NJDHS to serve their school age grantees and program providers. I know that one of our grantees in Patterson Passaic are tapped into your resources, but how can I get these supports out to all the grantees providers? Feel free, either of you.
I'm gathering myself. So you're tapped into, so I have a better idea. You're tapped into the Patterson Passaic NJ4S, and you want to know how they can benefit the grantees and providers that you're a contract with under DOE. Oh, I found, if that's what I'm curious. I don't know. I would need to learn more about like what exactly under the DOE, what type of program is. I mean, is that sort of what you're thinking, Diane and Michael? There's always a way to collaborate through tier 1, right? Presentations and workshops. That there's no boundaries being crossed there. There's no duplication. They're not with a tier 1. It doesn't have to be services that we're doing. If Catholic Charities or Rutgers or Family Connections or another agency is doing another program, we can sort of highlight that. And we say, co-presented by, sponsored by, collaboratively presenting on. But I'm thinking right off the bat to your question, the tier 1 is just maybe connecting with your Passaic County NJ4S and just making sure that if the information is being disseminated across, maybe there's a different way that they can be a part of either an ongoing meeting or maybe join the Passaic Community Advisory Board. So you're always kept abreast of what resources are available. That would be another more straight sort of option. I'm sure that they're willing to take on another, community board, advisory board member. But anybody else want to sort of add to that? And I hope I answered that.
I can provide an example in just that just recently came to mind, right? On, August 29th, Overdose Awareness Day. Lots of organizations are thinking at the end of the month, what can be done, how can we provide support. When our team is considering what we would do, right? We reached out to a local organization here in Mercer County, Mercer Council on Alcoholism and Drug Addiction, and just right down the street, they were hosting a large event, right? So instead of just doing an event on that day, we reached out to them and said, how can we offer support? We'd love to be a part of this event with you, right? What are you providing to the community at this event? And what would you like to continue to provide that we can offer? Right. And they let us know, and we put all that together, and now we're working with them on this event. Right. So there's so much opportunity for collaboration. Right. When, regarding the advisory board, right, 25% are parents and caregivers, right? But so many more members of the advisory boards are other community organizations, right, that run parallel to us, right, that are often doing the same kind of work, right? So we can collaborate together in those meetings and then out in the community as well.
Thank you both. So another question, oftentimes when newsletters go out, it includes events and prevention services that other providers are facilitating, but it appears that NJ4S is conducting the services. Can there be a clearer way to delineate?
Well, I think this was year 1 of our project, and we've all been building our presence in our particular counties, and for some hubs, multiple counties. And, I can say that when we collaborate with other community providers, our marketing materials would always have that individual's logo as well as the NJ4S logo, really just to, to kind of clear up any confusion about that. I don't think the intention would be in those cases for NJ4S hubs to be perhaps taking credit for things that other community organizations are already providing. But as I think, Michael and Ruby both touched on, a lot of our work is very collaborative. It is working very closely with other community organizations. While they may have very similar, missions, the provision of services might look a little bit differently. But here, I think we're kind of complementing one another and making sure that that landscape is a little more comprehensive in our particular counties. So we recognize, and we always say this, there's going to be far more demand, right, than oftentimes we can meet that demand. And so we're really grateful for our community providers that are already doing similar things and want to be very respectful that, again, as I mentioned, if they already have an established relationship, that we aren't jumping in and providing a service that's already been provided.
Absolutely, right. And, going forward, just thinking about what's coming up, where we have a lot of community partners in Mercer County who are sharing information on their back to school events, right? And asking, will you please get the word out, which we will do constantly. If we are a sponsor of the event, our logo will be on it, right? If we're not a sponsor of that event, we are just sharing it so that folks in our network, right, can see it, right, and go to the event as requested by, right, those facilitating that event.
Yeah, just exactly what Michael said is, if we're helping sponsor, whatever that means, if it's financial sponsor, we're going to bring, if it's back to school, the backpacks, or we're doing the snacks or something, then, we'll make sure that we put our logo and we have like strict guidelines on how our logo needs to be in place under DCF. So it's not, overpowering somebody else's. But if you're noticing, particularly with, your county or something, that it's not, the actual providers sort of getting lost, just have a conversation. Like, I'm noticing that, we weren't really highlighted this way, and we'd really like for you to highlight sort of the work that we do, right? We all work with family success centers, and we're all highlighting the work that they do. And it's, in collaboration, supporting, highlighting, existing resource, right? So for us, we sort of use those type of language, and I think other hubs do. But if you're noticing it's one or two things that, it's something that, there's probably have a conversation. It is year one. So, hey, year one, I didn't really see the clarity, in who was presenting one, and that would be solid feedback. I think that would be welcomed by whatever counties you're seeing that in.
Thank you all. And we have another question. Yes, will you receive a copy of this recording? Yes, the recording will be available on our website, on the AC&J website, in a couple of weeks. And the earliest ages that NJ4S supports are for. So my understanding, I feel like I can answer this one. My understanding is Tier 1 is universal, so there's K through 12, there's no age cap, but Tier 2 services and Tier 3 services are for students in grades 6 through 12.
You got it, Isaiah. That's exactly it. So we can provide the Tier 2 and the Tier 3 direct services, mental health counseling, as well as prevention groups to students in 6th through 12th grade. But any youngsters in pre-K programs on up could be eligible for workshops, parent presentations, teacher presentations, kind of some hands-on activity with the young children as well, but not the tier 2 or the tier 3.
And I'm just going to share an example of that. One of a town in Middlesex County that works with sort of that 0 to 5 population really just asked us to do how could we partner, and we sort of came up with some ideas, and one of them was maybe doing a in-person workshop with parents to understand like developmental milestones and things like that. Another one was we did something in the library where we had like sensory motor toys, and we like talked about like healthy play. We talked about communication. So even though you're not getting the direct, clinical services, there's other skill-based services that I think are definitely beneficial that you can, collaborate on.
That's right. Just to piggyback off of that, Mercer County, we started small with simply reading at local libraries for students on a biweekly basis, offering snacks, providing the books for students to take home and they can share the stories with their families. We worked with an ongoing series, the I Am series from Brad Meltzer, Ordinary People Change the World. And from there, we moved on to working with kindergarten classes, as well as parents in those classes as well, on this idea of absenteeism and the possibility of anxiety and managing anxiety as we transition from preschool into kindergarten. And of course, with the students, we don't refer to it as anxiety and or managing their anxiety, but come up with different kinds of games for them to play and understandings of how to reconcile what they may be feeling with something new. Lots and lots of options, and I'm going to stop talking after this quick second. The grade, what is so wonderful about this program, there are a variety of things that are wonderful, but NJ4S allows for creativity and it allows for imagination, which really means, which is why it's so critical for us to get input from the community at large. Right, programs like discussions of power at the local comic book store, Ruby, that's gold. Right, I'm kicking myself for it. That sounds like so much fun. I wanted to attend, and I want to put on my own. Right, Mercer County comic book stores, beware, because start knocking on doors. Right, that is one example, right, of how NJ4S has been and can continue to be creative, right? Meeting community members where they are, using those spaces, right, to discuss, right, traditional issues in non-traditional ways.
Right. Thanks to everyone who joined, and a special thanks to our panelists, our guests, our directors, our experts for the conversation today. Our information should be coming up on, no? Well, we can drop our information in the chat. And if you are interested in connecting to learn more about Michael's Hub or Ruby's Hub or Diane's Hub, feel free to reach out to either of us. All right. Thank you for joining. My information is in the chat, and take care, everyone.